me start recording here. Okay, let's go ahead and pull out the lab atlas. We are going to go over the appendicular skeleton for the lower extremity. So I want to start off by going over the os coxa. Now there's three different names that you can use if you so choose. You have choices here. You can call it the coxal bone, the os coxa, or the innominate bone. I use os coxa. It's just a habit that I've gotten into for a long time. Okay, so the os coxa is going to be made up of three bones that eventually fuse in your teenage years. So we're going to start off with this top one here, the superior and largest of the three bones, and that's called the ilium. Now, if you'll notice, when we're looking here at the os coxa, we're looking at the lateral side because you can see the acetabulum. All three of those bones will fuse here within the acetabulum. Right, so the superior most is the ilium. That's it from the lateral side. Now you can see it how it looks from the medial side. I know it's the medial side because I don't see the acetabulum there. Acetabulum is on the lateral side. Then you can see the ischium. That's going to be the posterior inferior portion of the os coxa. Check it out from the medial side. And then finally, the last part of the os coxa is going to be the pubis. And that's going to be the inferior anterior portion of the os coxa. And here you can see it from the medial side. So you want to be familiar, okay, with which side you're looking at and all these different points of view here. Okay, so now we're going to go through all of the different landmarks here of the os coxa. First is the most prominent, the obvious one, that's the acetabulum. And that's going to make up the socket for your ball and socket joint of the femoral acetabular joint. Up here, and this picture doesn't really quite complete it, but the iliac crest is going to be the superior most portion of the ilium. And it goes all the way down pretty much to there. All right, that's the iliac crest. So on the anterior portion of the iliac crest, where it ends, you have a bump there, and that's called the anterior superior iliac spine. Okay, you can see that on the lateral view. And then here it is on the medial view. That's the anterior superior iliac spine. Okay, so that's at one end of the iliac crest. Now what we're going to do is we're going to follow the iliac crest all the way back to here. And we're going to then see this bigger bump. That's called the posterior superior iliac spine. And when you put your hands on your back, and if you go just lateral from the spine, you'll feel two bumps on either side, really close to your hips. That's what you're feeling. That's the posterior superior iliac spine. And here you can see it on the inside, on the medial view, right here. Okay, posterior superior iliac spine. So you'll notice this nice smooth area here on the medial portion of the os coxa, or the medial portion of the ilium. That's called the iliac fossa. It's nice and smooth. Right, we're going to learn about the muscle that sits there. It's called the iliacus. We'll talk about that in chapter 11. Okay, but it resides in the iliac fossa. That's that nice smoothed area there. And then a little bit behind the iliac fossa, this roughened area that's outlined by that black line, that's the auricular surface. And the auricular surface of the os coxa is going to articulate with the auricular surface of the sacrum. And they're going to make a special joint called the sacroiliac joint. Below or inferior to the auricular surface, we have our greater sciatic notch, and that's where our sciatic nerve is going to exit out of your pelvis and proceed to move posteriorly and inferior down your lower extremity. Here you can see it outlined in this lateral view here. So that's the greater sciatic notch. Then right below the greater sciatic notch, you got that little nubbin there, and that's the ischial spine. The ischial spine is found on the ischium. And then below the ischial spine is the lesser sciatic notch. And then you are sitting right on this structure right now. If you're sitting, that's the ischial tuberosity, sometimes referred to as the sits bone, but this is the area that is doing the weight bearing of your body when you're sitting down. Also, your hamstring muscles, those are the muscles that are on the back of your thigh, attach onto that area there, the ischial tuberosity. Then on the last part of our os coxa is the pubis. So this portion of the pubis up here, that's known as the superior pubic ramus. That's above this structure or superior to this structure. That structure is called the obturator foramen. You can kind of see it. The angle's not the best, but that's all up and through here. That's the superior pubic ramus. Then you have the inferior pubic ramus. The inferior pubic ramus is more over here. That's the inferior pubic ramus. And then you can see it a little bit better here on the lateral view. And then, of course, the hole there is the obturator foramen. And then you'll see here the pubic symphysis, or that's the symphyseal surface there. All right, the pubic symphysis is going to make up the articulation between the left and right os coxa. Let me show you. All right, there. That's the pubic symphysis. Specifically, that arrow is pointing to that fibrocartilaginous disc. And that's where your left and right os coxa articulate with one another. There's your acetabulum. You can see it from the anterior view. Here it is again from the lateral view. And then those are your sacroiliac joints. That's where the auricular surfaces from the sacrum and the os coxa articulate with one another and create the sacroiliac joints. Female pelvis, how do I know? Very wide subpubic angle, okay, and the ilium flare out more. Okay, and the sacrum is a little bit shorter. It's really hard to see here. Okay, and also the acetabulum flare out more laterally. All right, with a female pelvis. And the pelvic brimlet inlet here, this area here is much shallower compared to the male. Here's the male. Okay, you can see here, the ones that really jump out at me are the subpubic angle. It's more sharper, okay? It's a smaller angle. And then the ilium does not flare out as much as it would in a female pelvis. Okay, let's get down here into the lower extremity and discuss the thigh. There's one bone in your thigh, that's the femur. It's a long bone. So you're going to have a diaphysis and some epiphysi or epiphysis, distal and a proximal. So in the proximal epiphysis, the rounded structure, spherical structure, is the femoral head. Now, one thing that I want to show you, okay, this view here of the femur is the anterior view. This is the anterior surface of the femur. And how I know that is, if I go down to the distal epiphysis, you can't see the condyles very well. I'll show you the condyles here in a second. And just to let you know, the side that the head is on is the medial side. Makes sense, because the head has to articulate with the acetabulum. And then the side opposite of the head is the lateral side. You need to know that, so that'll help you to figure out which is the lateral condyle or the medial condyle. So now I'm going to flip the bone over. And so if I go down here to the distal epiphysis, you can see the condyles much better. Okay, they're much more easier to see on the proximal, on the posterior view. So there's the femoral head. Then you'll see there's that little notch inside, and that's known as the fovea or the fovea capitis. That's where the ligament of the head of the femur attaches onto. And then where the head starts to taper down is called the femoral neck, or the neck of the femur. Here you can see it on the posterior view. All right, and then you have this big process on the lateral side of the femur opposite the head. That's called the greater trochanter. The greater trochanter is a site for muscular attachment. Okay, so that's the greater trochanter from the posterior view. Then you got this little nubbin opposite the greater trochanter on the medial side of the bone, and that's the lesser trochanter. You can see it a little bit better on the posterior view. That's the lesser trochanter. Okay, then we have on the distal epiphysis, we got the medial condyle. How do I know that's the medial condyle? It's because it's on the same side as the head of the femur. Look up at the top of the screen there. There's the head on the same side. Now we flip it over. Okay, you can see now that the arrow is pointing to the other side, and that's the lateral condyle. Opposite side of the head on the same side of the greater trochanter. Greater trochanter, all right, is going to be lateral. Then above our condyles, we have these little bumps we saw in the humerus. Okay, that's a site for muscular attachment. There's the medial epicondyle. And then over on the lateral side, we have our lateral epicondyle. And then in between our two condyles, we have a space there. It's the intercondylar fossa. We just talked about the anterior cruciate ligament and the posterior cruciate ligament. They reside inside that space there. That is the intercondylar fossa. And then you can see the beautiful view of the biggest sesamoid bone in your body. That's the patella. Okay, the posterior view is going to have that white there. That's the articular cartilage. All right, I'm going to stop here with the labeling, and we're going to quickly transition over into all right, let's finish up doing a little bit of course material presentation here to you and talk about the bones of the lower limb, the tibia and the fibula. This is the leg. Some similarities between the leg and the forearm. Okay, both have parallel bones. One bone will be medial, the other one will be lateral. In this case, we're going to put the bigger, stronger, more weight-bearing bone medially, so that's going to be the tibia. And then we're going to put the more dainty, slender, I don't want to say fragile bone, but the thinner bone, the fibula, we're going to put that laterally. And so we have a dense, regular connective tissue all right, found in between these two bones. We saw that in the forearm. We'll also see the same thing here in the leg. We call that the interosseous membrane. It helps to stabilize the bones at fixed positions from one another. Right? That's what we like. We like to have that stabilization. We don't want those bones banging into each other. And so we'll see some pivotal motion, very little. We talked about it in lecture. We talked about how the knee joint has a little bit of rotation in the flex position there. Okay, so we'll see, right, a little bit of rotation here. All right, so there's the tibia. You have your anterior view and your posterior view. Okay, be familiar with both. I'll show you a couple things to help you along with that. You'll notice, and usually when we present these long bones, we don't really flip them around on you. So you can pretty much assume that the bone that is closest to the top of the page, that's going to be the proximal epiphysis. And then the part of the bone closest to the bottom of the page is going to be the distal epiphysis. Right? It's safe to assume that. So when we're talking about the tibia, we're going to start off by talking about the proximal epiphysis. And on the top of the proximal epiphysis, you have a flat surface there. It's called the tibial plateau. And so that flat surface is going to articulate with the femoral condyles. And so where it articulates, the medial femoral condyle is going to articulate with the medial tibial condyle. You can just call it the medial condyle, right? So it's just a flat surface on the top of the tibia. So you have a medial condyle and a lateral condyle. And there's a little bit, it's going to be like this. You have a flat surface, then you have this little raised area here, and then you have another flat surface. And this raised area is called the intercondylar eminence. It's a site of attachment for ligaments. All right, so staying on the proximal epiphysis, you're going to see there's a bump right below your knee, okay? The top portion of your shin there. That's called the tibial tuberosity. That's where the patellar ligaments or the actual quadriceps tendon attaches to. That's the tibial tuberosity. That'll be the bump just below your knee, below your kneecap there. All right, then going down to the far distant distal epiphysis, right, you're going to encounter the medial malleolus. And the medial malleolus is, if you go down to your ankle, you'll feel a bump, a process on the inside of your ankle. That is called the medial malleolus. That will be on the medial portion there. All right, the other bone in your leg is the fibula. This is the non-weight bearing bone that's lateral to the tibia. All right, there's only three things that you need to know for the fibula. Two are proximal. Okay, so we have the head of the fibula, and then it narrows down into the neck of the fibula. The neck is important because you have a nerve that comes in close contact to the neck. It's called the common peroneal nerve. And if you fracture the neck of the fibula, you can sever that nerve and get lateral paresthesia or anesthesia, and you can get paralysis of the lateral compartment muscles in your leg. And you'll know what I mean by that is when we get into the muscles, I'll tell you, but that's the peroneus longus and brevis. And then at the distal part of your fibula, you'll have the lateral malleolus. So again, go down to your ankle, go to the lateral side of your ankle, you'll feel a bump. And that is the lateral malleolus. So the lateral malleolus and the medial malleolus, right, will show you where your ankle joint is. And then you'll have the talus bone in between those two bumps there. Okay, so we're going to run into some similarities now between the upper and lower extremity. We saw in the upper extremity, when we got to the wrist, you had 8 bones there, and those were called the carpal bones. They were short bones, right? But when we get to the foot, it's a little bit different, right? We call those bones tarsal bones, and there's only 7 of them, and they're not really considered short bones. They're more irregular shaped bones. So we do have 2 rows. We saw that in the wrist. We had a proximal and distal row. The same thing occurs here in the foot. We have a proximal row and a distal row. In our proximal row, you only have 3 tarsal bones. All right, the first one is the talus. That's going to make up your ankle joint. It's the superior most tarsal bone, all right, of your tarsals. Then you have your heel bone. That's the calcaneus. That is where your Achilles tendon, also known as the calcaneal tendon, it attaches onto the posterior portion of the calcaneus. And then just in front of your talus on the medial side is the navicular bone. So those 3 bones make up the proximal row. Your distal row is made up of 4 bones. Okay, you have the cuneiform bones, there's 3 of those, and then the cuboid bone, that is the most lateral bone. So the 3 cuneiform bones, starting with the most medial, we call that the medial cuneiform. And then we have our intermediate, then lateral. And then our most lateral bone in the distal row is the cuboid bone. And I'll go over some of, where these are and whatnot. I like this foot x-ray because, one, it's pretty good quality, but it does show you some of the positioning that we can see. This dorsal view, this is a superior view. We can see the metatarsals really nicely. You have metacarpals in the palm of your hand. You have metatarsals in the arch of your foot. And then you can kind of see, all right, the proximal row here, or excuse me, the distal row of your metatarsals. So here is your first cuneiform, then you have your intermediate cuneiform. It's tough to see the cuboid and the lateral cuneiform because they're overlapping each other here. All right, this is the navicular bone right here. But you can really see nicely on this lateral view, here's the calcaneus, and then you've got your talus up here, and then you've got your navicular bone right there. All right, so a couple views here. Let's quickly run through. All right, you can see how the talus here is in the anterior view. You can see how the tibia and the fibula articulate with it. So your medial malleolus is here, and then your lateral malleolus is here, and they sit on either side of the talus there. So here's the talus from a superior view. Now it's from an inferior view. We're looking up through the bottom of your foot, partially obstructed by the calcaneus. Speaking of the calcaneus, that's the heel bone here. Right, we can't really see it too well from the superior view because the talus is in the way, but you can see it very nicely here from the inferior view. And then our third proximal tarsal bone is going to be the navicular bone. It's medial right here in front of the talus. And then, of course, we got our distal row tarsal bones, our cuneiforms. You've got your medial cuneiform, your intermediate, and then your lateral. Now notice the medial cuneiform articulates with metatarsal number 1. Your intermediate cuneiform articulates with metatarsal number 2. And then you have your lateral cuneiform, which articulates with your metatarsal number 3. And then metatarsals 4 and 5 are going to articulate with your cuboid bone. All right, the metatarsals. From here on in, it is going to be autopilot for you folks. And what I mean by that is this should be pretty easy because there's a lot of similarities between the hand and the foot. Here's one. The metatarsals. These are the bones that form the arch of your foot. All right, we label them the same way as we did in the hand. We use Roman numerals 1 through 5. We start medially with your big toe. So your big toe, the first metatarsal is Roman numeral number 1. And then your second toe is 2, 3, and so forth and so on. And then your pinky toe is Roman numeral number 5. So these bones are going to articulate with either the cuneiform or the cuboid bone. Either or. It's going to be one of the cuneiform bones or the cuboid bone. And then from there, they will articulate with a proximal phalanx or proximal phalange. Now, in the first metatarsal, we will see two small sesamoid bones near the head. And sesamoid bones are bones that are going to be found within a tendon, specifically the flexor hallucis brevis. That's basically the muscle that flexes or curls your big toe. So here are all the metatarsals 1 through 5, and you can see it's quite easy. Okay, starting here with the big toe, and then moving laterally towards the pinky toe. Easy, easy. All right, finally, we have the phalanges. Again, same number of phalanges in the foot as there were in the hand, 14. That means that one digit only has 2 phalanges, and of course, in this situation, it's the big toe, the hallux. All the other ones have 3 phalanges. So the first, your big toe has a proximal and distal phalange. All the other toes have a proximal, a middle, and a distal. It's hard to believe that the pinky toe has a distal, has 3 phalanges in it, but it does. All right, so if you notice here, you only have 4 toes that have a middle phalange. All the rest have a proximal and distal. So what are the 7 tarsal bones? Okay, in our proximal row, you have the talus, the calcaneus, and the navicular. And then in our distal row, you'll have the medial, the intermediate, and lateral cuneiforms, and then our cuboid bone. All right, let's do some labeling real fast here. All right, go ahead and pull out your atlas here. And so here we're looking at the tibia. This is an anterior view. How do I know it's an anterior view? I can see this fellow right here. That's the tibial tuberosity. We'll talk about that in a second. So how do I know if I'm on the left or excuse me, how do I know if I'm on the medial side or the lateral side of the tibia? Easy, go down to the distal epiphysis. And you'll see this little nubbin hanging off. That nubbin is the medial malleolus. That's the bump on the inside of your ankle. So if the arrow is pointing up there to the tibial plateau and it's on the same side as the medial malleolus, then that must mean that that's the medial condyle. Now, I'm going to flip this bone over here in a second. So watch this disappear. It's gone. So this is the posterior side. But the medial malleolus is still down here. And so the arrow's on the same side as that. So that is the medial condyle. That's how you'll know. You will not lose points if you listen to me and what I say. Trust me. All right, flipping the bone back over, we're on the anterior view. We can see the tibial tuberosity there. And then we are on the lateral side because the arrow is pointing to the opposite side of the medial malleolus. So that is the lateral condyle. Flip the bone over. Here it is on the posterior view. There's the lateral condyle from the posterior view. All right, so the lateral condyle of the tibia will articulate with the lateral condyle of the femur. Same with the medial condyle. The medial condyle of the tibia will articulate with the medial condyle of the femur. So in between the condyles of the tibia, you have this little raised area there. That's the intercondylar eminence. Things like to attach to that structure. That is the intercondylar eminence. And then you have that bump there right below your knee on the proximal end of the tibia. That is the tibial tuberosity. That's where the patellar ligament attaches onto. Okay, down to the distal end. The only thing you need to know for the distal end is the medial malleolus. Okay, that's the nubbin at the far end. Here it is on the posterior view. Right. To the other bone in your leg, the non-weight bearing slender thin bone. Okay, here is the fibula. Okay, so the arrow is pointing to the head of the fibula. Then where it starts to narrow down, that's the neck of the fibula. Fibula is easy. There's only 3 structures that you need to know: head, neck, and the lateral malleolus. Now, please make sure, and I know I keep saying this, and I'm going to keep saying it because I don't care, right? But you need to be able to identify the bones and say which bone is which. Do not confuse the fibula with the ulna or the radius. Do not confuse the femur with the humerus. Some people will have a tendency to do that. You should be so good at identifying these bones that if I were to show you a picture of the bone, you should be right away able to tell me what bone that is. All right? I don't expect you to know which bone it is for the phalanges or anything like that. I'm talking about these unique long bones. You should know those. Okay, so here you can see the lateral malleolus of the fibula. It's superimposed against the tibia. It's tough to see, but it kind of comes down like this. Okay, that's the lateral malleolus. It helps to give that stability, that lateral stability to your ankle joint. Okay, so let's move into the tarsal bones. There are 7 of them. Here's the calcaneus. That's going to be your heel bone. Okay, your Achilles tendon or the calcaneal tendon will attach onto the backside right there. Here it is on the medial view. If you get a fracture here, they call it a hatchet fracture. That's easy to remember because I always thought that the calcaneus looked like a hatchet head, an old primitive stone hatchet head. All right, the talus. Here is the superiormost tarsal bone. This is going to make the talocrural joint, which is your ankle joint. On the medial side here is where the medial malleolus will attach from the tibia, and then on the lateral side over here is where the lateral malleolus of the fibula will attach. It makes that modified hinge joint. All right, here's the talus on the medial view. All right, the last bone of the proximal row is the navicular bone. It is medial to the talus and more anterior in front of the talus there. Here it is on the lateral view, medial view, excuse me. All right, then we have our cuneiforms. Now there's 2 ways that you can label it. Now I've already talked about the medial cuneiform, but if you would like, you can also use the Roman numerals again. So the medial cuneiform can also be written down as cuneiform Roman numeral number 1. All right, that articulates with the big toe. You can see it here on our medial view. And then you have your intermediate cuneiform, also known as cuneiform 2, that articulates with the 2nd metatarsal. And then we have our lateral cuneiform, also known as cuneiform number 3, that articulates with the 3rd metatarsal. And then we have our cuboid. That's the last tarsal bone in the distal row, and it articulates with both metatarsal 4 and 5. Okay, on to the metatarsals. Here we go, same as we saw in the hand. Okay, so metatarsal 1 is going to be medial, and then you just move right across. Metatarsal 2, and then we have metatarsal 3. All right, then we have metatarsal 4. And then, of course, we have metatarsal number, there's 4, metatarsal number 5. And here it is laterally. And then our phalanges. Okay, every single toe has a proximal phalange. Every single toe has a distal phalange. So here's the proximal phalange. All right, for the big toe, there's the proximal phalange for your second toe. Here's the proximal phalange for the fifth toe. Then you have your middle phalanges, but you only have 4 of them. Middle phalange for your second digit, and the middle phalange for your 5th digit. So here's the middle phalange for the 3rd, and there's the middle phalange for the 4th. And the middle phalange for the 5th, it's tough to see. I don't know why it always does that. You can see it better here. And then last but not least, the distal phalanges for all 5 digits. Distal phalanx 1, distal phalanx 2, and then the last one will go all the way to the last digit, distal phalanx 5. Crazy how your little toe has 3 phalanges. That's it, folks. That's all, folks. Okay, so any